This conference will now be recorded.
Hey everyone, thanks so much for joining us today, and I hope that you are doing well. I'm Jody Collada with Wellspring Solutions, and as we continue our virtual programming, I'm so happy to be able to partner with Pace of the Triad. We have a great team today, and we're going to be doing part 2 of Caregiver Bootcamp. And as you may experience or just know from talking with friends and family, taking care of a loved one with chronic illness is very difficult, and finding access to respite and resources can be a challenge. And also, if you are a care recipient and someone's taking care of you on an ongoing basis, that's also very difficult. So I just want to share some information with you about Wellspring Solutions, as we offer home and community-based services to help caregivers in the community as well as their loved ones with dementia. So I'll just briefly highlight some of our services before turning it over to the PACE team. We do offer memory screenings in the community, as well as memory fitness classes. We are licensed through UCLA to do that series. And we also offer Dementia Dialogues, which is a 5-week series. We are certified through the Arnold School of Public Health out of USC to do that. We have our memory care center, and that is for individuals who are over 60 and have a diagnosis of dementia. We offer activities to engage our members, enhance their physical and memory fitness, creative expression through music and with art. We're open Monday through Friday from 7:30 to 5:30 and have staff to also assist with personal care needs. Our Connections and Memory Club is an abbreviated version of our adult day program, offering socialization, lunch, exercise, lots of activity, but we do not provide any hands-on care. Caregiver education. Like today, we offer classes on a variety of different topics, whether it's those self-care skills, hands-on skills to be able to take care of your loved one safely, or self-care strategies, dementia care topics, legal, financial, end-of-life planning. Caregiver support is offering support groups. We have 2 now that we offer on a virtual basis, so caregivers can just share their story, get resources, and connect with each other, even if it's via the computer. And our navigator, you see our picture here of Nicole. She's our social worker navigator. If you or a family member or a friend just don't know where to turn, what services would meet your needs best, please contact Nicole. She can just guide you with the services that can help you, whether they're with Wellspring Solutions or a community partner like PACE. So please just go ahead and visit us on our website or give us a call. And now I'm going to turn it over to Stephanie Wallace. She is the intake coordinator with Pace of the Triad, and she's going to introduce the team and some information about Pace as a resource for you in the community. And I thank you all in advance so much for partnering with us again on this bootcamp.
Thank you, Jody. I want to welcome everyone to part 2 of the Caregiver Bootcamp presentation. As Jody stated, I am Stephanie Wallace. I'm an intake coordinator here at PACE. PACE is an acronym, and it stands for Program of All-Inclusive Care for the Elderly. We are a managed care program for adults aged 55 years and older, and we provide medical care and support services to help adults continue living in the community. We've been serving adults in Guilford and Rockingham counties for 9 years. Today, some of our staff will provide information and share some techniques to assist you as you care for your loved ones at home. Taylor Zabinski is one of our social workers. She's going to provide some self-care tips. Ellen Smith is going to talk about causes and ways to overcome caring with a loved one who may be resistant to elimination or toileting. And Elaine, one of our occupational therapists, is going to demonstrate different types of durable medical equipment. So I want to thank you all in advance for joining us, and please feel free to use the chat box or ask questions during the presentation. So at this time, I'm going to turn it over to Ms. Taylor Zabinski. Thank you, Taylor. Taylor, I think you may be muted. I can't hear you.
Still getting used to that. Thank you. So as she said, I'm Taylor Zabinski. I'm a social worker here at Pace of the Triad. And I'm here to talk to you today about caregiving and self-care. So basically just kind of managing yourself. So during this time, I won't have too much time to spend providing a lot of specific education, but I do want this to be a time where folks can share and add as they feel moved to do so. So I just want to ask as we move forward just to kind of be mindful if there are any comments to be mindful of the time, and I will do the same. So when I'm talking about self-care, I'm talking about ways to manage your own anxiety, worry, and sadness. And that can be very difficult to do as a caregiver, especially one with an older adult. Um, Being a caregiver is selfless. It is simply being someone who gives assistance to another person who is no longer able to perform the critical tasks of personal or household care necessary for everyday survival. Just some quick facts about caregiving I will share, which I'm sure some of you already know, are almost 7 in 10 caregivers say they help at least one person. Most caregivers are helping their relatives, and nearly 80% of care recipients over age 50 are over age 50, but the other 20% are between age 18 and 49. And 1/4 of those caregivers report that they are caring for someone age 50 or older, and they're experiencing Alzheimer's, dementia, or mental confusion. Those are some of the many facts, quite frankly, that a lot of you caregivers are dealing with right now. And Ellen and Elaine are going to share specific tips to help you care for the loved one, but I'm going to share tips to care for yourself in my portion. Your role is impactful and selfless, so I hope we can talk about this together and you can share if you would like. So please feel free to stop me. I'm not looking at myself, so just kind of blurt out. So just some tips for caregiving that will kind of play into the self-care that I hope that you guys can start practicing after today or just, implement. One is just to give yourself a break. This is a difficult time, especially with coronavirus and everything. So definitely just try and give yourself a break. 2, take a crash course in the disease because the more you know, the more confident you feel. It's kind of like learning how to walk. You don't just learn it all in one day. It takes time, but once you get used to it, you get your feet under you and, you just feel a little more confident. 3, seek assistance from others, however that may be. So a church, another program such as Wellspring, PACE, a family member, relatives, long distance relatives, just someone that you can make sure that you seek assistance from others. And 4, implement financial and legal planning. So what I mean by that is just plan for the future. So those advanced directives such as living wills, power of attorneys, financial power of attorneys, even burial costs. Those are some of the things that if you can have that discussion with the person now, I would really encourage you to do so you don't feel that strain and pressure of making those decisions when they can no longer speak for themselves. I do get that question sometimes, and it's a really tough one for me to answer. So I do try and encourage people to talk with their medical provider if they're not with PACE. If they are no longer able to consent, I would still seek support from a medical provider or a resource such as the Senior Center who can help get those documents started with you and have those conversations with you. But if you do have more questions about that afterwards, I'm happy to talk with you because if I start on that, that's a whole conversation in its own. But my last 2 tips are just join a support group. There's many virtual sports groups. As Jody said, Wellspring does their 2 a month, and I know that is very successful and helpful to the caregivers. Definitely make sure you're finding a community of people to share these thoughts, feelings, and situations with, because I know the professionals are great, but you guys tend to be experts when you're the ones doing it hands-on too. So, and my last one would be take advantage of a community resource such as the Senior Center, PACE Services, Meals on Wheels, Wellspring. There's even a number like 911, but it's 211, and it's through United Way. That is so you can find real, relevant resources for you to help your loved one and even yourself. So there are a lot of programs out there to make your life a little easier, caregivers, so you can take care of yourself better. So, are there any other thoughts or tips that someone would like to share that has made caregiving easier for you before I talk about self care a little more? I'm just going to throw that out there. If not, it's okay. I'll go ahead and keep going. So what's going to happen if you don't practice self-care and work towards being a more successful caregiver in your own eyes? There's this thing called compassion fatigue, and I don't know if anyone's ever heard it, so I'm sorry if I'm repeating something you've ever heard, but compassion fatigue is the natural consequence of stress resulting from caring for and helping people who are suffering from chronic health diseases. Compassion fatigue is a set of symptoms and not a disease. It's the outward signs we experience are displays of stress resulting from giving care to others. Compassion fatigue is the name that has been attached to these symptoms so that we have a way of identifying it in ourselves and in others. Once you can identify that, you're able to take action and manage that distress the disorder is causing in your own life. So, in working with older adults, the most common method of coping with discomfort we experience is to stifle the emotions that arise. And sometimes that's the only way we can continue to do the caregiving work that we want to do. So, what am I saying to you right now? While the work involved in recognizing and learning to manage compassion fatigue can be arduous and draining, the basic message is simply that help is available. Compassion fatigue is a set of symptoms, not a disease. And once you can change your mindset to this thinking, you open to that door to power of healing. But much like a wound, if you don't care for the injured area, the wound can flare up and perhaps even become infected. So if you're not taking care of yourself, and you're just going to get back to that point where you were before. So how do we work on that? You kind of address different parts of your life, and there are different domains to your life that are important. And so I've made a checklist for caregivers, and I want to run that through that with you guys and just see if this sparks any thoughts or feelings, or if you want to add this to your own. If anyone would like it, I'm happy to share it. And so let me just pull that up on my end. So self-care caregivers, the five physical, sorry guys, the domains I'm going to talk to you about are about physical health, social health, emotional health, spiritual health, and caregiving health. So under physical health, I want you to ask yourself, are you seeing your doctor regularly? Are you taking your medications on schedule? Are you exercising? Are you eating nutritious meals regularly? Are you getting enough sleep? Are you misusing drugs or alcohol? Social health. Are you seeing family and friends on a regular basis? Are you keeping up with at least one activity you enjoy? Do you have fun at least once a week? Emotional health. Are you getting ongoing emotional support for caregiving situation from at least one person? Do you have at least one outlet for stress? An enjoyable activity, confiding in someone, writing, exercise, meditation, relaxation techniques? Those are some of the things that you can do for an outlet. Do you understand that typical emotional responses to caregiving include denial, anxiety, frustration, anger, guilt, shame, and grief? Spiritual health. Have you attended a religious service in the past? And if you have, do you plan to keep doing so? Is your faith community aware of and supports your caregiving situation? Caregiving health. Do you understand the diagnosis and prognosis of your loved one? Do you understand what type of care the person needs and have a plan to provide it? Do you have the person's and your own financial and legal situation understand? Do you have a plan for the future and your needs as they change and how you can make that plan? Are you in regular contact with other caregivers? And those are questions that um, I share with I ask other caregivers when talking about self-care because, it starts with asking yourself those questions. So with all that being said, does anyone want to add to this list, or can you think of ways in the past that you've found yourself needing a break? What about yourself in your daily routine became different? Is there anyone that wants to share? I'm just going to kind of pause for a second.
Taylor, do you recommend any specific ideas as it relates to COVID and isolation?
That's a good question, and I'm just going to pull up something I have here because COVID is causing a lot of anxiety during the pandemic, and I'm sure as a caregiver it's even harder. I know many people are struggling with isolation. So write it down. Write what's going through your mind. Your hand is slower than your mind. Writing down your thoughts can slow down the worry of your thoughts. Schedule worry time. This is really about postponing the worry. And instead of arguing with your mind and trying to force yourself not to worry, give yourself permission at a designated time in the future. Counter those thoughts with positive supportive statements. Conclusively work with your what if and worst case scenario thoughts. And keep your virtual connections going. That's what's really going to help is keeping connected with others. Is there anything else?
That's great.
So just that question I kind of threw out there at the end of about figuring out how you really need a break. We all have things in our life that we enjoy doing. And I know from personal experience when I was taking care of my grandmother before she passed away, that there at the end it got really tough and it was on me. So something I enjoy doing in the morning is a morning cup of coffee on the porch. And when that cup of coffee became bitter, I had to realize that I had to take a step back and change something about my routine. It's really tough, but caregiving is very challenging. And so that's why you have to address your own physical and mental health because you not cannot take care of someone else without taking care of your own self. So just to remember to be easy on yourself. You're your own worst critic. And if there's any other thoughts or feelings, I would love to hear this. I do appreciate it. I know I had to be in the outside area. It was too dark inside. So if there's any thoughts or feelings before I hand it over to Ellen, I'm right here. Take it away,
Hearing none.
Ellen.
All right, thanks, Taylor. That was great. I appreciate it. And there's a lot of overlap between what you shared and what I'll be sharing. I want to start off by saying that I so appreciate what caregivers do. My gratitude for you as caregivers is just off the charts. Our world would not function nearly as well without volunteer caregivers, and it's a hard job. As Taylor said, it's emotionally draining. It requires physical stamina. It takes a lot of fortitude, and I so appreciate what you do. One thing that we don't always think about when we think about caregiving skills is that you need to be able to be a good thinker, and you need to think about what you're doing as well as physically do it. So we're going to include that process, thinking, in 4 tips we're going to go over today. You can see them on the screen. What's the cause for the resistance of care? How we can plan to prevent some of that resistance? Ways to reduce resistance if our planning doesn't nip it in the bud. and what to do if people continue to be resistant to care. So under the first skill, we're going to talk about what is the cause of resistance. You need to think about it. Could my loved one be hungry or thirsty or tired? Could they be bored, be anxious, be sad or mad? Could they be in pain? Or could they just have some discomfort? Now, pain and discomfort, a lot of people think they're the same thing, but they're not. Pain is a little more intense and it's physical. And discomfort is also physical, but it's more like my pants are too tight, or I need to go to the bathroom and I'm constipated and I need to go to the bathroom. So that's one category, thinking about what is going on with the person. Are they annoyed with role changes? Do they not like the fact that my son is having to take me to the bathroom? Is there a schedule change than what they really like? Think about the medical condition that's going on, either an acute condition or a chronic condition. Does your loved one have dementia, and is it just a natural disease progression? Does your loved one have Parkinson's disease and they're having more delays today? Are there speech problems impacting communication? Do they have any condition that causes pain or fatigue? Or is this an acute problem? Is this something brand new? Could it be an infection? And we'll talk a little bit about that later. And this may sound silly, but could it just be a phase of the moon? There are a lot of things that the moon makes worse. I know I don't sleep well when it's a full moon, but just, that's another silly thing. We got to think about everything. What can be the cause of resistance? The next step we're going to take is we're going to plan to prevent some of the resistance. The first thing you do to help with that is help maintain the person's routine as much as possible. You may have been living with this person for years and you have an advantage. You already know their likes, their dislikes, their habits, their preferences, their routines, especially about going to the bathroom. They always have a bowel movement after lunch, for example. Or do they always have to sit on the pot a while with a cup of coffee? Are we allowing them to do that now? Think about it. You may want to even take some notes about their preferences, their likes, their habits, or routine, because that will help you be organized. It will help you come up with a plan, and it will help you share your thoughts with other caregivers as you need to bring others in. You can also make note of the routine by watching them over a period of time, or asking them or other caregivers, what do they like, what are their routines, etc. This is especially important if you are coming into the caregiving scene recently. Maybe you haven't lived with this person a long time. You might need to watch them or ask the person they used to live with. And then take those notes all together and make a schedule out. Make a daily schedule of things that need to be done. For example, I've noticed he has a bowel movement after lunch, so I'm gonna make sure that happens, but he also has to urinate in the mid-morning and afternoon and twice before bed. But also make sure that you schedule other needs like mealtime. When are meals going to be offered? Bathing, toileting, sleep or naps, socialization, exercise, leisure activities. You need to think of everything you need to be scheduled and write those down. Even like medical treatments. When do they need to take medicines, or is there a wound that needs to be drained? Then write that schedule down, have a calendar of weekly or monthly events. This will help you work through changes. It helps you remember what you need to do when you are so tired you can't think straight. It also helps bringing in other people easier as well. The third bullet point there is ways to reduce the resistance. What if you've planned and done all of that, but they're still resistant to care? The first thing you need to do is make sure you're treating the medical conditions that are causing the resistance. The chronic conditions, continue all prescribed medications and treatments, and let the doctor know of any changes from baseline so it can be looked into. Sometimes it's an infection. Sometimes it's a medication interacting with another one. Sometimes its needs are just changed. Then follow routines that you've already identified that include preferred ways of doing things. Be flexible on the things you can be flexible on. You know, if somebody does not want to go out for a walk today, even though they normally do, ask yourself, do we really need to take that walk? Just because it's on the schedule doesn't mean you have to. Always make sure you're telling the person you're working with what you're going to do before you do it. There's nothing worse than standing there and all of a sudden having hands unexpectedly on you trying to get you to go somewhere. So make sure you tell them what you're going to do before you do it. Make sure they heard you and understood you. Consider their sensory deficits, like do they have a hearing problem or a vision problem, and make accommodations. But you'll know about that because you've been working with them for a while and you know how to communicate with them. I say always make statements to guide people rather than ask questions. A lot of people have trouble dealing with questions or making choices, especially if they have dementia or if they're already annoyed or resistant to care. So don't ask them questions that you don't want if you can't live with any answer they give you. For example, instead of saying, Daddy, do you want to go to the bathroom now? Well, what would you do if he said no? So say, it's time to go to the bathroom. It looks like you need to go to the bathroom. If you see somebody giving you their cues that they need to go to the bathroom, say, it's time to go to the bathroom now. Come on, let's go down the hall. Ask yourself again, do you think the person is hungry? Are they thirsty? Are they tired? Do they need to go to the bathroom? Do they have pain? Or are they in discomfort? And fix that item first. Allow them to rest, give them something to eat, make sure if they're mad or sad, offer a listening ear, say that you're sorry, and then try to get their attention onto something else. Try to divert them to something else. The last thing under this bullet is promote independent actions. Help the participant, the care recipient, do things on their own as much as possible. For example, if you go to the bathroom, take them to the bathroom, close the door and stand nearby and kind of keep an ear out and see if they seem to be needing help, you can step in, or if they ask for help, you can step in. Or go to the bathroom and tell them what to do step by step. Daddy, it's time to take your, undo your zipper, pull your pants down, sit on the commode, step by step, telling them what to do. At some point, they may not be able to do even those things. And at some point, you may need to actually do the physical task yourself. But again, always make sure you're telling the participant ahead of time, I'm going to take your pants down now, Dad. And if you can use your hand to guide their hands in that process, they will feel like they're participating it all the more, and that will be less difficult for them. And then what if they are still resistant to care? I'm going to say, look in the mirror. Ask yourself, are you hungry? Are you thirsty? Are you tired, in pain, anxious, mad, or sad? Your loved one may be picking up on your mood, or your mood may be impacting how you're responding to your loved one. See what you can do for you. Use some of Taylor's self-care tricks. And remember that caregiving is a marathon. You have to take care of yourself. Next, step back and think about the task causing the resistance. Can it be postponed? Can it be skipped altogether? Is there a new way to do it that would be less troublesome? And then if all of those things fall through and you believe that this resistance is now the new normal, think about what can be changed in the routines. Would a regularly scheduled nap be helpful? Does the food plan need to change from 3 large meals to 5 smaller meals? Would some equipment in the home help reduce pain or fatigue? Do you really need to try to do that task? Could you modify it in any way? And remember to write down any changes you make in the routine and your caregiving notes, your schedule, your calendar. Elaine is going to be up next, and she is going to tie some of the things I said together, along with use of equipment in the home, and use some tips on how to physically help participants or loved ones know how to move. I'll turn it over to Elaine.
Thank you so much, Ellen. That was a wonderful uh, description of how we care for resistive patients. And this is really the whole nut of everything that we do here at PACE. And when we're working with people who have Alzheimer's or dementias, and they have different stages, and of course they still have themselves inside. So I'm here to just help you with some of the physical aspects of getting a resistive patient to do or be cooperative during care. But also I want to tie into that always communicate. The most important thing that you can do with your loved one is, like Ellen said, be mentally prepared. As Taylor said, do things for yourself so that you can be sure that you have a good presentation to your loved one. Be emotionally ready. Like Taylor said, it is very difficult to do caregiving, but we do it from our heart, but we don't always check ourselves. So as Ellen was saying, look in the mirror and be sure that you are very mentally and emotionally prepared, and then you are physically prepared to do this as well. So taking care of your health, taking care of your nutrition, yeah, and making sure that you are well enough to do caregiving. So with that said, I want to come back to that. Remember that all behaviors have a reason. So as Ellen was talking to you about, we really don't want to ignore these behaviors. We don't want to brush them under the rug, and we certainly don't want to be aggressive towards these individuals. They are doing the best they can, and just remember that they're not there to aggravate you. They just can't always communicate what they need for you to understand it. It's much of it is like being with your children, if you have any, or with small ones, because they don't always articulate to us or communicate to us what they need, but they act out instead. And this is just normal aging for us as well. I want to remind people that when we age, we actually lose things in the reverse order that we gained them. So as we age, we actually start getting younger. And with that youngness, we start physically declining as well, going from upright position to seated position to eventually the bed position. But also, we start losing the ability to bathe ourselves. We start getting into those childlike behaviors where water is an aversion. We don't want it on our face. And these kinds of behaviors are really easily detected when you have somebody fighting when you want to give them a shower. But also I want to just mention too is that we start to not be able to sequence dressing. So these are all indicators that when you think about children learning how to bathe themselves and learning how to dress themselves, they actually, we start losing those abilities back to those stages where we don't sequence. So maybe if you put clothes on my arms, I'll be able to put them over my head. Or if you put pants on my feet, I probably would pull them up. So these are the kinds of things that you want to kind of think about when you're working with people who have dementia. Dementia to me, and as in health professionals, are really much of a neuro disorder. And so when you think about neurology, or I'm going to have you think about neurology in this way. So neuro is really the brain function along with the spine function, and these are the electricity of the body. And if you think about it as the electrical system, sometimes those electrical systems start to get rewired and mis-circuited. And so what you can do is use your hands in order to facilitate some of those things that may not be firing as we like to. And also, when we think about the body and the neural components of the body, we also get triggered or we respond to a much of a sensory load that comes into the environment. So we need to be really careful about how that affects or triggers a resistive behavior. So conversely, you can use sensory to allow people to be calmed and feel happy. And so knowing your loved one about what they like to smell in terms of maybe fragrances or food, which is a real common one, tasting things that are good, that are feel-good foods, because when we're older, we don't have to worry about our diet as much as the loved ones would need to, who are able-bodied. Also, what we hear. So I want to really remind people that your tone of voice, how loud you are, the repetitiveness of trying to give somebody lots of instructions all the time, that can be very disturbing and increase the agitation. So hearing is a really big thing, even though as well as not being able to hear. So if somebody can't hear you, then that can be anxiety producing and a source of frustration and cause an agitated behavior. Primarily, we do also look at our sight. So everything that we see, are you coming with a big smile on your face, with an open, where your arms are open out to the side? You're not coming in with a folded arms, ready to fight kind of presentation. So they're picking up visual cues as well as we come in. What if I came in very rushed and hurried and I've got to get something done? That's going to create another resistance, that because that scares people when we rush in and start talking and wanting to do things. And this is, again, trying to make sure that you're mentally prepared and emotionally prepared. And lastly, the sensory of touch. Touch is a very important thing. Obviously, if we're aggressive with our touch, it's going to make people feel like they need to fight. If we're calming with our touch, or if we're gentle with our touch, that tends to bring people back into a more calming space. So we're going to reduce our voices. We're going to have pleasant smells for those loved ones. We're going to try to be sure that they see how we love them, and that our touch is going to also provide that calming effect. With that said, when we do have people at the very later stages, you may not be able to direct them by verbal cues. You may need to use what we call physical cues. And at this point, you'll see me on the screen. I'm going to put my mask on because I have Ellen with me, and I want to show you some key points of control for being able to physically move your loved one when they're not quite coordinating movements. As we get to the stage where walking and standing and pivoting are not so well coordinated. So with that said, I'm putting my mask on. I apologize for that. I hope you can still hear me. All right. So I have my friend Ellen here, and I want her to come into the screen. I'm going to actually put you in this position here. Okay, and I want you, before you sit down, Ellen, I just want them to see sideways. Ellen has this very nice belt on. This is called a gait belt. This allows me to help Ellen and keep her safe without pulling on her arms or her body that can cause injury. So with that said, I'm going to have Ellen have a seat. And when I'm trying to get Ellen to get out of this chair, she's really not wanting to do that. But she also is not coordinating this activity very well. So what I want to tell you is that a lot of times people come in front and they're pulling on people, and that just makes people resist, right? And then if I come back here, if I have you just lean forward, if I come back here, there's a spot down here, well, you can push somebody forward, but wait a minute. A lot of times in late stages when I come back here, people are resisting me. So they're going to come back. If I'm pushing forward from the very center of the spine, they're going to want to come back. So I want to just kind of point out to you the trickiness of getting somebody to stand is not necessarily the hips or the spine or the gait belt, but it's the scap area. The scapula area is the area that is where we call the wings that are off to either side of the upper body. So if you feel that bone in the back and you come down to the bottom part of that bone and you just gently come underneath it and lift up, your loved one will be more likely to stand up gently. Okay, so when she sits down, it's going to be a different point. I'm going to come to the front part of her hip where it bends, and I'm just going to gently press that while I'm holding on to the scap to get her to sit. So it's under the wing to stand, and it's on top of the shoulder at the hip, and at the hip where it bends to sit. Now, if I have somebody who can't move and they're in the bed, I'm going to show you what points of control you can use in the bed. So we're going to walk over to the bed and I'm going to turn my screen so you can see us. Yes, please. If we're all in there, you're going to actually be on your back in the center of the bed. And I was not coordinating bed mobility at all. So what I'm going to do, I'm a very tall person and I'm all about positioning and making sure things are staying. Well, do we have juice? We don't have any juice. In a great environment, I would raise the bed, but oftentimes people have conventional beds anyway. So I may end up having to be in where the surface is lower than me. I tend to be often protecting myself, so I'll put a knee on the bed in order for me to protect my back. If I need Ellen to roll towards me, I'm actually going to take the opposite knee of me. So whatever side you're on, you're going to take the knee that's on the other side and just bend it up. Once you have that knee bent up, you're going to take the arm and bring it over. And if you have railings, you're going to want her to hold on to the railing. Once you have that arm out of the way, I'm going to come back on the hips and gap again and roll her. And that's actually the easiest roll to do, so I can do care. Okay, so again, it's the scapula of the hips while bending the knee up. And if I needed her to come down, I'm still using the knee that's up in the air to bring her down and have her lay flat. And then I go to the other side for her to roll to me from the opposite side. And that's pretty much the physical points of control we want you to have. And I do want to show you some equipment. Oh, I'm going to let you go. Sorry about that, you guys. Okay. Now, I just want to mention that we do have PTs, OTs readily available at PACE, but when you're looking at equipment as your loved one starts to lose the ability to walk or it needs assistance while walking, it's really important to talk to either your physical therapist or your occupational therapist to find the right assistive device that would be for your loved one. But for this demonstration, I'm going to show you a couple of different things that we use that's the most common sorts of assistive devices. Again, when we're talking about sensory, there's a lot of people who will not use a walker. I just got told today by a patient that she didn't want to look like an old lady. And I also know that if I have something that looks kind of pretty, a little bit stylish, that my patients, especially with dementia, will actually use this more than they would use some plain type of equipment. So again, I'm really looking at some sensory things as well when we're talking about equipment. Now this is a rolling walker, and it's probably the safest walking device that we issue to our loved ones because you can support yourself with two hands, and it actually helps prevent falls. The other assistive device that's commonly used that a lot of people would like to use is what they call a rollator. Now rollators have seats, and I think when I say they have a seat and they look like a walker, you'll understand what I mean by a rollator. The rollator has 4 wheels. And the 4 wheels actually are a little bit, require a lot more actually, coordination and a lot more steadiness. But oftentimes people like them, especially loved ones for the ones, or especially the caregivers for their loved ones, because when you're out in the community, you have a seat readily available. But they're most dangerous if you have somebody who's not coordinated. For one thing, you have to, every time you stop, you have to use the brakes so that you don't suddenly get distracted and the rollator goes out from underneath you. But also, like, the most important danger of it is the 4 wheels. They don't have any secured to the ground. The other 2 assistive devices or mobility devices that we issue are wheelchairs. Wheelchairs, as opposed to a transport chair, have a large wheel on the back, small wheels in the front, and brakes in the front that that the patient can use or you can use in order to brake when they're going from sit to stand or stand to sit. Okay, so this is what a wheelchair looks like, and I just want to review the transport chair. The transport chair does not have large wheels in the back, although this is a fancy one, and doesn't have brakes that the participant or your loved one can use. It is actually for a caregiver to have full control over. It's for somebody who wouldn't be able to use their legs or their arms to get around by themselves. The brakes generally are at the back, on the bottom. This is a transport chair, it's a fancy one. It has the brakes on the top like a rollator. But again, the patient does not have control over keeping the brakes on, and this is 4 wheels as well. So you always want brakes on when you're standing from sitting and sitting to standing. So with that said, just want to go and recap. Remember that what we're talking about here is be well prepared to work with your loved one. And when you're working with resistive behaviors, just be prepared. It all, like everybody is talking about, know what you need to do to take care of your loved one. That's safe. Be mentally prepared and emotionally prepared. And then I hope that you've learned some things to be physically armed in order to help. If you have any questions, I'm ready for questions now.
We actually do have 2 questions, and Elaine and maybe also Ellen, if you both want to be on camera and unmute yourselves, you might both have a different way to address the question. Great. The first one is, and also if you ask the question, Mike, I'm going to have your question first. Please feel free to unmute yourself, Mike, if you want to elaborate. But the question is, what can one do with people who are resistant due to vanity? Because we talk a little bit about dementia, but what if it's due to vanity? Use a cane or a walker. And if, Mike, you need to elaborate at all, you can feel free to unmute yourself. And after, I have another question to ask as well.
Well, I think that's a great question. And before you threw in the piece about and don't want to use a walker because of it, I was going to say, know what their routines are and take that into consideration and allow them to do all those things that their vanity requires. My mom wouldn't go out in public after she required oxygen, and that was partially her upbringing and her stigma to it, but it was also her vanity. But she would use a cane only if it was floral decorated and would fold up and be out of sight once she got in her chair wherever she was going. So think about modifications that can be made. I'm sure Elaine's got a lot more tips than that.
Oh, vanity is one of the biggest things that I work with men and women. And again, it goes back to, as Ellen said, prettying it up. So my mom also would not use a walker or a cane, but I did discover in some medical supply areas that there are some nice blinged equipment out there. And once she got one that looked like it was diamond from top to bottom, she went out prideful with this, and she would use it everywhere. Everybody was asking where she got it. So I think we in society need to do a little bit better job providing equipment that is for people who are vain, or we all are to some extent, and I don't mean that in a negative way. I just think image is a big thing. And I hope that one day that we can just overcome this. I think it's a generational thing as well. And because therapy really hasn't been all involved in the care of the elderly forever, but when we did get involved, we started demanding using this and demanding that. And it was truly that people did not want to be seen with this because of the stigma attached. So as much as you can do to decorate it, paint it, I have done so many things, even with oxygen. We used to put like pretty cloth around this so that it would look like it was a part of their decoration or part of their accessories. So that's a very valid question, and it's a very difficult one at times. But if you can find that shining penny, definitely it works. I hope that answered your question.
I'll be looking into the chat to see if there's any more info from that regarding that question. I do also have questions regarding specific tips, and Ellen and Elaine, please, if you will address this regarding, yes, the ever difficult bathing question. How to get your loved one to take a bath when they don't want one or insist they've already taken one. And same issue about someone who's resistant to the shower. And I did share with them, I have a kind of a presentation on this very topic. There's so many things to kind of explore. What is the reason, perhaps comfort level, fear? There could be a lot of things to explore and try to find out why they don't want to even have the bath or the shower. Is it the temperature? Is it the privacy issue? But if you could share some specific tips to help these caregivers, that would be wonderful.
Elaine, I'll let you take that one.
Okay, so yeah, because I'm an OT and I work with that quite often, I first want to remind people that it is really only in the United States and countries that are first world that have this huge need to make sure people are in a shower. And what we know is that health-wise, a shower is not necessary, but it is a need for the caregiver to have their loved one be showered. So I want you to sort of, this is the first step of trying to be flexible and think differently, is that, you know, are they clean? And if they're not clean, I tell you that even the most advanced person with dementia will respond to a very quiet, do you realize that I need to clean you up because you smell, or because you're dirty, or because, you know, using these very basic terms that you would use towards a child, but also in an adult manner, and trying to make sure that's a dignified thing. It is very real that as we lose function in dementia, as soon as we start losing that coordination, we start to, well, even before losing coordination, we already start to have an aversion to having a shower. And it really has much to do with splashing water on the face. This is a very anxiety-producing type of activity. So another way you might approach a shower, if the person's agreeable, is to have a seated shower where you have a handheld shower head that would not allow the water to go up past the neck. And when you're doing the head and the face, it can be a washcloth type of situation where you're doing a sponge bath on the face. But it is okay to sponge bathe. As long as, like I do foot spas for my loved one in order to get the feet done. I use baby wipes for peri area because it's easier for me instead of doing a lot of laundry. I also, make sure that there's a sponge bath being done. So there's ways to stay clean and healthy without actually getting into the shower. But it is one of those things that becomes an aversion as a result of the natural degeneration of the brain. Now, I will say another thing. I do want to mention that there is a part of the brain that is emotionally intact. So the more you're kind of gentle and I really care about you, again, this hits an emotional area that creates a trust that can create an avenue that would start a process that you might be able to bathe. So these are kind of tricky things. These are just, there's a number of different ways that you can do this, but it's just finding that, again, that shiny penny. But we don't get too concerned if they don't bathe for, every day or once a week, as long as they're clean and we're not getting any health problems as a result of it. I hope that answered your question.
Yes, it did. Thank you. That was very helpful.
Jody, I think you're on mute.
I was on mute. Thank you. Feel free, please, caregivers, to ask your questions if you want to take yourself off of mute. If you have any follow-up, hopefully you found this helpful. Hopefully you found all of the information and the expertise of the PACE team helpful. Are there any other questions anyone wants to ask or put through? That's very helpful. Okay, wonderful. I'm so glad. And team here, Elaine, Ellen, and Taylor, Stephanie, does anyone have anything else that they wanted to add before we part? Thank you so much, Stephanie and Taylor. I think you're off camera. Thanks so much for partnering with Wellspring Solutions on our second boot camp. We already talked about the possibility of doing number 3. And those of you joining us, if you have topics that you would like us to cover, like, again, the bathing tips, I mean, certainly that is something that caregivers are challenged with. If there's any other topic that you would like to see us address, please just send us an email or visit the staff over at PACE. But thanks so much for joining us, everybody, and I hope you have a great rest of your day.
Thanks, everyone.
Thank you. Bye-bye.
Take care.
Bye-bye.